Hello everybody, my name is Dr. Stephen Barry. Welcome back to another video vignette from Insulin IQ. With me today is Dr. Curzon, who is a practitioner in my area, and I'm glad you'd come and spend some time with us today.
Thank you.
What I want to talk about with you today is helping people understand your experience as a physician in understanding insulin control and how nutrition plays a role in health. I have noticed that in my practice, this was kind of a journey for me to find how I could facilitate the health with my patients and be a force, because so much of my practice was handing out medicine as a reaction to the disease states that I was finding in my patients. And I became very excited as I started to see some of the results from inviting my patients to eat low carb, high fat. Tell me how you came to find this and how what role it plays in your practice and in your life.
Sure. So I practice general internal medicine. My patient population is 18 till hospice. Honestly, I do all of that. And the, no pun intended, bread and butter of my practice is metabolic syndromes, diabetes, hypertension, high cholesterol.
So you see a lot of people who are affected by insulin resistance.
Absolutely. Every day, all day.
Wow.
I wouldn't say every patient is insulin resistant specifically. There's certainly a large population that's not, although I still think that this approach to eating is still healthy for anyone, or the majority of people that can tolerate these kinds of changes in their lives. But a huge portion of my population is metabolic syndromes and insulin resistance.
Tell me, so I understand better, what is metabolic syndrome and how would I know if maybe I'm a candidate for that, or if I should go talk to my doctor that I might have metabolic syndrome?
On the outside, most often people notice their weight and their body morphology and changes there that they're not happy with. But it gets down to the other levels of your cholesterol being high, your blood pressure being high, your kidneys being a little bit off. Certainly moves more aggressively into type 2 diabetes and other forms of insulin resistance. Sometimes skin changes, sometimes presentations with autoimmune disorders can be a part of that, as I've learned.
Okay. So if I have type 2 diabetes, that means I've probably had metabolic syndrome for a while, and then the end stage is type 2 diabetes.
Yeah, I would say diabetes is really almost the end stage manifestation of metabolic syndrome. Starts so much longer before the presentation of diabetes. Yeah.
So if I'm getting a physical at my doctor's office, how would I go about finding out if I have metabolic syndrome? What questions would I ask my doctor?
So people will come in, many times they'll have had labs just before they've come in, a day or two before, sometimes not. Occasionally there are manifestations outwardly where I can just look at somebody and they're presenting with full-on diabetes, and other times it's just much more subtle. They're younger, they are being a little bit active, but more sedentary lifestyle sometimes, or they just eat poorly, fast foods generally, things like that. Breads and French fries tend to be the mainstay, soft drinks, and we find a little early marker on a blood test, a blood sugar or a triglyceride level. They don't usually just screen and get insulin levels right off the bat, but if they did, it would be interesting. We'd probably see that much higher long before sugars ever climbed. It isn't always the weight that triggers it. Sometimes people will come in and we'll see labs that are a little bit off, or they'll come in and they will have had a physical exam by an insurance agent. They said, well, my blood sugar is a little high, my cholesterol is a little bit off, what do you think? I feel well, do I have to take medications?
Right. Okay. So tell me at that point, so I'm sitting with you in high school, maybe I'm a little bit different looking than I was in high school. That's a question I ask my patients, is tell me what you felt like when you graduated high school versus how you feel now. I try and get them to focus on how they feel in relation to their health. What would you talk to me about at that point in relation to keeping their insulin in check? How would you invite them to look at that, their nutrition, their insulin?
I usually start with introducing the ideas of how we eat and how they're eating, what their habits are, seeing what their activity levels are, and approaching it from that standpoint. I used to be more of the mindset before I was introduced to this approach of, well, if your sugars are high and your cholesterol is high, here's some medicine and we'll see each other in 3 months. Try to eat,
very familiar.
And I would say, try to eat better. And they would say, well, what do you mean by that? And I say, Just try to eat better.
That sounds very familiar.
You don't have a lot of time. You've 10, 15 minutes with a patient and you're trying to help them, and you give them a few websites that you've pre-printed and you say, here, go look at this and I'll see you in a few months. And that approach for me has changed dramatically since I've walked down this path.
Be nice to your doctor. This is a hard thing. There's not a lot of time to sit down and negotiate and discuss how to help your patients, and the term eat better is such a confusing term. I've been doing this over 20 years and I don't know what eat better means.
Yeah.
Tell me your experience with your patients. You've had several hundred patients now accept your invitation to look at their insulin levels and try and lower them through their nutrition, which is the antidote for metabolic syndrome and type 2 diabetes.
Let me share really quickly the first patient that I started down this pathway that helped me understand the power of eating and taking control of your diet this way. She is an elderly patient, 60s, and she came to me. I hadn't seen her in about 8 years. She'd moved out of the state and just moved back. She comes to me in a wheelchair, and she had a herniated disc, and she had already seen the neurosurgeon prior to my visit with her, and she said, well, my surgeon said there's no way around this other than surgery, but my A1C, which is a 3-month measurement of your blood sugars, is above 13. And he said,
that's very high.
Yeah, he said, I will not touch you until your A1C is less than 8, which usually would take several medications and several months to do in my experience with that.
Yeah, mine as well.
So she can't do exercise. She's wheelchair bound. She can't move very well. And so I said, first she said to me, and I've scheduled surgery for 5 weeks.
Wow.
And I was a little flabbergasted. I said, I don't think we can do that.
It's ambitious.
And this was 2 years ago. And this was just as Rich had introduced this to me, and I was just barely starting down this pathway and just starting to understand it myself. And I said, okay, here are 3 medications, pills, and she was already on 50 units of long-acting Lantus insulin. And I said, we're going to turn that up to 80 units, and here's 3 more oral medications, and let's see each other in 4 weeks. And oh, by the way, here's a diet I'd like you to consider. I didn't really explain it too much to her. I gave her some websites. And I said, why don't you look at this and just see if you can introduce this to what you're doing? And she, I didn't think she would take that to heart. She came in 4 weeks later, and her A1C 4 weeks later was, I think, 6.7.
Now, this is just 4 weeks later?
4 weeks.
So an A1C is a 90-day blood sugar average. So for it to change that much in 4 weeks is significant.
Significant. So my first response was, oh, my medications have worked. And she dropped her head and she said, I did not fill any of your prescriptions.
So she didn't take any pills that you prescribed her?
Didn't touch them. And then I said, oh, then it must be the extra 30 units of insulin that I prescribed. And she dropped her head again and she said, no, I've actually cut it from 50 to 25 units. She cut her insulin in half.
I know what she did.
And I had actually not even remembered introducing the diet very much at that point because it was so new to me. I was just, it really threw me. I really tried to wrap my head around this, but she had engaged a low insulin way of eating. She had cut out carbs aggressively. Oh, she had also dropped 13 pounds in a wheelchair, not exercising. I'm not proposing anyone not exercise, but without being able to exercise,
she's limited.
So she aggressively took the challenge. She cut the medicines down. Right now, she had surgery a week later. There were standard follow-up rehabilitation from her spinal surgery, but she maintained, and we did end up getting her insulin down to somewhere around 7 or 8 units. After that, she still takes a little bit with an A1C that's maintained relatively low.
Wow.
She's gone off the diet and found the numbers go back up, and she goes back on the diet and finds it comes back down. But that was my introduction to what the power of this could be. Since then, I really engaged this more aggressively with patients on a very regular basis, and have found over the last 2 years, as I've done this, I still use medications. I'm an internist, that's what I do. But I have found for patients who are willing to engage this, I have stopped more diabetes medicines, more blood pressure medicines, more cholesterol medicines very safely, not just stopping them just willy-nilly. I've stopped them safely on more patients than I have started. And that's been a wonderful thing.
How does that feel after a lifetime of practicing medicine to be able to have in the balance less medication prescribed than more medication?
Yeah, I have jokingly through the years, I've been in practice for 16 years, I have jokingly said I'm a legalized drug dealer. I'm an internist, that's my tool. I'm not a surgeon. I use medications to deal with metabolic syndromes, and now to have found a dietary approach, a lifestyle approach that is extreme, it takes effort, it takes motivation, but to find a way that people could maintain to lessen their drug load, their medication load over time. Medications have side effects, cost, interactions. More and more insurances just say no and puts the cost on the patients. And for the sake of shifting your mindset about carbohydrates and eating and insulin, I've been able to help people have been able to see that eating in a certain way can save them from a lot of medications and side effects, and with wonderful better outcomes than I can many times do with medications. Drug reps will come to my office and sell a diabetes drug and say, in 3 months we can lower their A1C 0.2 or 0.3, and I counter back, with the diet that I encourage, I can lower their A1C 4 solid points in a month. And they look at me, and it's funny, I have several diabetes drug reps that are engaging keto or low insulin eating.
That's great. Well, thank you for sharing. I have to tell you, after 20 years of doing this, going to work for me is so much more exciting than it's ever been, because in the balance of my day, I am withdrawing more medication than I'm adding. And I consider that a win, because the medication is making up for a disease state. And as the disease state disappears and you can withdraw the medication, that's the goal, I think, of what you and I are about, is helping our patients heal and be healthy. Dr. Curzon, thank you for sharing your time and your story with us. Appreciate you being here today.
Thank you very much.